So as you get better at the first stretch we did for internal rotation, I want you to eventually progress to doing it 90-90. It's a little more challenging. So if you have a lack of rotation, a lack of overall mobility on that hip, let's start with the first one I listed here in this section. Let's call 90-90. We're focusing on the back leg here. To start off, I want to kind of square it off on our front leg. So think the front knee here is going to cut your belly button and sternum in half. From there, I want you to feel your knee traveling away from you, kind of it's disconnecting your femur from your pelvis, trying to really reach that way. Good. From there, think about tucking pelvis towards the floor. So if I'm here, and I'm sitting down towards my back ankle there. And then from there, have your belly button and sternum together, start rotating towards your back ankle. Good. Keep that pelvis locked down towards the floor. It doesn't have to touch the floor. It's not the goal. The goal is to have it stuck in that direction there. From here, if you have a lot of mobility, you can play with rotating more and also crawling towards your back ankle to get a nice deeper stretch here. This is going to be a very different stretch than most stretches. It's going to feel deep and it shouldn't feel pinchy or sharp. If it does, then go to the first video, work on that. It should feel like a deep, like tissue stretch, but it shouldn't be painful. From here, breathing in, stretching for 30 seconds to 2 minutes. From here, after the end of the stretch, breathe in, pack that air in, 20% effort, think ankle through the floor. So the ankle and knee are pressing through the ground, but the ankle is pressing harder than the knee. So going that way. And let's ramp up tension, 40%, push ankle more through the ground, pretend your ankle is traveling out in front of you. 60%. 80%, squeeze a little more. Let's go to your best effort now. When I count to 1, 20%, the opposite direction. Stay where you are and think knee to the ground, ankle up. 3, 2, 1, 20%. Think ankle towards the ground or towards the ceiling now. The contraction should feel different now. It should feel more on the back of your hip here and almost through this front hip area region as well. Let's go 40%, squeeze more, think knee to the ground, ankle up. Obviously, nothing's moving here, that's the goal. The goal is to have it static contraction here. Try and get stronger in this position. 60%, squeeze a little more. 80%, squeeze a little more. And best effort for 3, 2, 1, and slowly relax. As you relax, do not move out of position. If anything, try to move deeper into the stretch if you can. So for this one, how to move deeper, think that's tucking your pelvis more towards the ground and trying to rotate belly button and sternum back over towards your back ankle more. And that should get a deeper stretch there. And then when you're ready, go ahead and go for it. If you have any problems with that position, then regress to the first one I put in this series. This is the most advanced option there is. If there any knee pain or ankle doesn't feel great, you can't find that contraction, find that stretch, then immediately go back to the first one I shot here.